How is delayed gastric emptying diagnosed? Have you ever wondered how doctors figure out if someone has delayed gastric emptying? This condition, also known as gastroparesis, can be tricky, especially for those dealing with sensitive stomachs, irritable bowel syndrome, or colitis. Let's break down the steps involved in diagnosing this condition. The process begins with a detailed medical history and physical examination. Your doctor will ask about your symptoms. Common symptoms include nausea, vomiting, bloating, feeling full too quickly, and abdominal pain. It's essential to share all your symptoms, as they can help your doctor understand your situation better. Next, your doctor will look for signs of other conditions that might cause similar symptoms. Conditions like irritable bowel syndrome or colitis can sometimes overlap with delayed gastric emptying. This is why a thorough examination is so important. To confirm a diagnosis, several tests can be performed. One of the most common is the gastric emptying study. In this test, you will eat a small meal, often eggs and toast, that contains a harmless radioactive tracer. After eating, special cameras will take pictures of your stomach at regular intervals over several hours. This helps determine how quickly food leaves your stomach. If a lot of food remains after a set time, it suggests delayed emptying. Another option is the gastric motility breath test. This test involves eating a meal with a special substance. Your breath is then analyzed at intervals to see how fast your stomach empties. This test is less invasive and does not involve radiation, making it a good alternative for some patients. Doctors may also use an upper gastrointestinal endoscopy. In this procedure, a thin, flexible tube with a camera is inserted through your throat to look inside your stomach. This helps rule out any blockages or other issues that could be causing your symptoms. Imaging tests like X-rays or ultrasounds can also be helpful in checking for physical abnormalities. For those with sensitive stomachs, irritable bowel syndrome, or colitis, these tests are generally safe. However, it is always a good idea to discuss any concerns you may have with your healthcare provider. The results from these tests will help guide your treatment options, which may include dietary changes, medications, or other therapies tailored to your needs. Understanding how delayed gastric emptying is diagnosed can help you feel more prepared when discussing your health with your doctor. Always remember to share your full medical history and any concerns about your digestive health. This will help ensure you receive the most accurate diagnosis and care possible.